Hi, Dr. Pichini here, and I'm a chiropractor here in the Rexdale Etobicoke area. Today, we're going to talk about the median nerve and levels of compression. So typically, the median nerve gives you sensation into this area that we see here in green. The thumb, the second finger, the third finger, and half of the fourth finger. When someone has carpal tunnel syndrome, we're talking about compression of this medial nerve right at the carpal tunnel, so literally right at the level of the wrist. Sometimes people get surgery for this, and 6 months later, their symptoms in the hand return again. And oftentimes, the carpal tunnel gets misdiagnosed. It's actually not a carpal tunnel issue. It's actually the nerve being compressed at a different level we call the Pronator Teres. So the Pronator Teres is basically this muscle that starts here at the elbow and goes across, as you see here in the red. Now, if this muscle becomes tight enough to compress on the median nerve, you're going to have symptoms similar to the carpal tunnel syndrome. And it doesn't matter how much you do treatment to the wrist, the symptoms will not be resolved and the condition will not improve because treatment needs to be directed at the Pronator Teres. Usually you can diagnose Pronator Teres syndrome through a number of different tests. One of them we call the Tinel's test. So what we do is we actually take a reflex hammer and we can provoke that nerve. If she ends up getting numbness and tingling in the distribution of the hand that we discussed before, could be a possible sign of Pronator Teres syndrome. Another test that we do is actually some pressure provocation. So putting pressure right over the median nerve at the level of the Pronator Teres. That actually might create some numbness and tingling into her hands, and that could tell you that there could be some compression at that level. One final test that we can do is a pronation test, resistant pronation test. So what we're actually going to do is we're going to hold the wrist here and we're going to get her to try to bring her hand all the way down. So try to bring the palm down and we're going to hold it there for a couple of seconds. If she reports any numbness and tingling going into her fingers, then that could also be an indication of the Pronator Teres compressing on the median nerve. Now for some treatment. So